Hello everyone, this is Stefan Hartman, Iron Direct Primary Care, bringing you my lecture on Alzheimer's and diabetes and preventing dementia. Let's jump right into it. So dementia is a massive problem and estimates are that it's increasing. By 2050, we're looking at annual healthcare costs perhaps 1.1 trillion. I think that's a low estimate. There are traditional theories on why dementia appears, but it's focused on the end stage of dementia. And that's where they're finding therapeutic targets for this. Um, Kind of the common reasons that are thought dementia occurs is cerebral vascular disease or Lewy body disease. We're going to go into it a little bit detailed here. So, visualizing Alzheimer's, so PET scans, we find that there's increased beta amyloid levels in patients with Alzheimer's disease. So when researchers look at this, they say, well, there's increased beta amyloid disease. So, how do we decrease this? Should we be focusing on the metabolism of this, or should we use drugs to target this? And you already know the answer to that. It's let's use a drug to target this. Let's look at the end stage, this beta taurine accumulation in the brain, and let's find a way to decrease it. Okay, so the FDA has approved a couple of drugs, but they don't work very well. They recently approved a sixth drug, and it got a bit of bad press because it looked like it was going to cost $56,000 a year. And even the FDA didn't like that too much. One of their panel members quit because this drug got approved. And they are saying that's kind of a breach of interest or conflict of interest there. So they have the common acetylcholinesterase inhibitors. These are some of those medications here. This is actually a slide from a CME course that I did, kind of a continuing medication course that I did. And I saw this one. I was like, oh, let's see what the latest is on Alzheimer's disease since I'm researching this. And they propose some interesting targets for therapeutic agents in the future. Yes, of course, the tau and the amyloid medications to target those. But my interest was metabolism and bioenergetics, and they put metformin on there, a diabetic drug, and also anti-inflammatory medications and targets. And I was like, oh, interesting, maybe they're onto something. But really, at the conclusion of their lecture, they really just are focusing at the end stage of the disease. I'm thinking about prevention, how to prevent this in the first place. How can we be proactive against this? So in my research in the literature, I'm finding associations between alterations in glucose metabolism and the prevalence of Alzheimer's disease. When you look at PET scans, when you look at the way glucose is utilized in Alzheimer's brains, you can see that it's dysregulated, that there's a problem here. And so that proposes new therapeutic targets. How do we prevent this? How do we improve this glucose dysregulation in the brain? And, well, there's research, emerging links between type 2 diabetes and Alzheimer's disease. And so they're proposing, links between insulin resistance, dyslipidemia, sedentary habits, and how to correct these and maybe prevent diabetes and Alzheimer's. They're proposing that microvascular disease, fibrillar deposits in the brain in Alzheimer's disease, and in the pancreas in type 2 diabetes, insulin processing alterations, inflammation, obesity, and altered levels of insulin-like growth factor. These may all contribute to Alzheimer's disease, and these are all targets. How do we prevent these things from happening? Microvascular disease, that's really interesting. Very small, clot formations, very small, not getting enough blood flow. There's another article, Diabetes and Alzheimer's Disease Crosstalk. So they're studying diabetes increases the risk of Alzheimer's disease, diabetes induces tau pathology, and diabetes and Alzheimer's share multiple neuropathologic mechanisms that are similar, and anti-diabetic compounds are a promising therapeutic approach to Alzheimer's disease patients. And this is good because maybe we get some research from Big Pharma on this because this is a potential for them to make money. Wow, can we treat diabetes with medications to prevent Alzheimer's? So this is a new way to market it. And I'm not promoting Big Pharma here, But here are some medications that potentially could help Alzheimer's disease. So they're looking at GLP-1 analogs, so Trulicity, Victoza, these diabetic medications that are approved for diabetes. They're looking at, hey, can this help in Alzheimer's? Which, medicine is run by Big Pharma. So if Big Pharma is going to do these studies for us for their drug, we're going to use those studies and we're going to see how can we utilize this, basically a pharmaceutical ad for our own holistic benefit. How can we help patients? Maybe not with medications, maybe with medications, right? We're going to have an integrative approach here. So that's one part of it. And then I like to talk about toxin accumulation. And there's pretty good evidence that toxin accumulation in the brain can predispose to diabetes. We're talking about dietary changes related to Alzheimer's, fungicide residues, aluminum adjuvants in vaccines attributed to Alzheimer's. Let's see, more on aluminum here. Military service, that's an interesting one because Gulf War disease, pretty bad one. A lot of veterans have cognitive problems, metabolic dysfunction. Many veterans that I see in the clinic, really bad diseases here, and it's most likely from their military service. Exposures to war agents, chemical agents, trauma, TBI, traumatic brain injuries, and just the stress, the PTSD that war puts on the brain, and the toxins that are injected into the soldiers, vaccines and so forth. And The Guardian has a really cool article here on really a lawsuit case that was awarded to a soldier who said that the vaccines induced osteoporosis, bone disease, and this is kind of a landmark one because this means that a lot of soldiers might be able to sue and get reimbursed for the damages inflicted upon them on war from the military. But really, it comes back to the most common variable, which is insulin resistance, glycemic variability. And we can fix this. We can reverse this at any stage of life. We can improve our insulin resistance. And we're not fated to our genetics, right? We talk here on the channel about epigenetics, how we can turn on or turn off our genetic code to either cause disease or maybe reverse disease or even prevent disease. So in theory, Alzheimer's disease could be prevented by, avoiding toxins. Try not to inject yourself with too many weird things, not to that eats all this junk food, these toxins that are in all their processed foods. Exercise science, improving that glycemic variability through improving your musculature, improving your insulin sensitivity through exercise and muscle strength training programs. Protein leveraging, we're utilizing low carb, low sugar diets, eating nose-to-tail animal sourced foods. So essentially the same mechanisms and methods we've been talking about on this channel for over 2 years now, we can utilize these to prevent or maybe even reverse Alzheimer's disease. And at Iron Direct Primary Care, we have an integrative approach. We approach patients not only from the holistic side, but also from the conventional medicine side. And we're not going to completely disregard conventional medicine. The GLP-1 inhibitors are powerful medications. We might be able to use these for some patients. Metformin is a great medication, especially for patients who are insulin resistant. We need to improve their insulin sensitivity. So maybe we use a metformin in combination with a strength training program, an exercise program, a nutrition program. We use both at Iron Direct Primary Care. We are an integrative practice. So we're bringing the best of both worlds, holistic and conventional. And we're applying it to patients in a unique perspective here. And that's all I had for you today. I hope you enjoyed this lecture on Alzheimer's and diabetes. There definitely is a relationship here, and we have to be aware of it. In addition to that, toxins, chemical products, these definitely play a role in Alzheimer's dementia as well, especially among our veterans. Appreciate you coming to join this lecture. I'll see you all next time.